For mercury poisoning, please be familiar with sources of mercury and toxicity of mercury. Please be master of symptoms of mercury poisoning and the treatments for mercury poisoning. First, we will talk about the sources of mercury. Before we talk about the sources of mercury, we have to know in the whole world we can find 3 different forms of mercury. The mercury exists in the world with elemental forms and inorganic forms, and the last one is we familiar with is organic forms. For the organic forms, we call it methylmercury. The methylmercury can make a disease called Minamata disease. The Minamata disease, the patient's symptoms just like a dancing cat, so we also call it dancing cat disease. Why we call it dancing cat disease? Because the patient will have ataxia symptoms. This make patients inability to coordinate voluntary muscle movements, so they can't have the steady movements. They are unsteady, so we call it ataxia. But not all the time with uncontrolled muscle movements. After that, they will feel numbness in the hands and feet. With the numbness of hands and feet, they feel the muscle get more weakness. And with the symptoms get more severe, they will have narrowing of the field of vision and damage to hearing and speech. Some of the patients at last, they can't see, they can't hear, and they can't speak. At last, they will have insanity, paralysis, coma, and even death. And more special for this kind of chemistry is it can go through placental barrier from the mother to the baby, so affected the fetus in the womb. So where we can find mercury? For the mercury, it commonly used in the scientific and electronic equipment. And it also can be used in the electrodes and the battery manufacturers. And very special, in a hospital, you also can find mercury. They quite used for the dental amalgams. And we also can find it from the manufacturers which extraction of gold from ohms. And it can be used for pressure pumps. Now let's move to the toxicity of mercury. The mercury has 3 different forms, so the toxicology of mercury for these 3 different forms has a little bit different. For the liquid mercury, it can be vaporized readily at room temperature, and hence inhalation of mercury vapor is the prime route of entry. So the skin absorption is not the main route for mercury go inside. The prime route of entry for mercury is the mercury vapor, but we can still absorb mercury through the skin, and it both for the metal and its compounds. So for the elemental mercury and the inorganic and organic mercury, they can go through the skin inside to the body. So for the mercury, inhalation is the main route. 60 to 80% of mercury go through inhalation into the body. For the skin, with 3 to 15%. And we also can have the GI tract, but this is unusual. But for the inorganic, 15% we go through GI tract, and the organic 19%. We all knew the mercury goes inside a body because of mercury goes inside to the fish first, and the fish change the mercury, the elementary mercury, into the organic mercury. Then the organic mercury make this Minamata disease. So for the organic, 90% will go through GI tract. This is quite special for the mercury. And we have to know the elemental mercury is able to cross the blood-brain barrier and also crosses the placental. So that is why mercury can have damage for the fetus. But the inorganic mercury compounds do not cross the blood-brain barrier. For the inorganic mercury, they are widely distributed in other tissues. So after that, what's the symptoms of mercury poisoning? The mercury poisoning depends on the forms of mercury, and it also depends on duration, intensity, and the route of exposure and the chemical forms. So that is mercury health effects depends on different things